my usual procrastination worked out great because somehow I managed to push my presentation to the very end of the year. This name, the Uncommon Psychomotor Injury, I wanted to call it the Uncommon Cognitive Injury, but as we see it going through, there was a little bit of psychomotor. I wanted to introduce my podcast co-host, my wife, Sharla. So those of you who met her, she's also our patient case for today. And those of you, and I can see a couple of you, who have consulted on that case with me as I tried to figure how to navigate this situation. Be quiet and don't ruin it for the rest of everybody else who has to figure it out. Although I expect somebody who's going to just get it right out of the gate, and then, you know, the gig is up on this one. I have no disclosures. Get your CME. Okay. Kind of like Dr. Gustin's presentation last week, right? A photo is just a photo. But this is actually inside this brain. I just love looking at the complexity of this organ that we have. I mean, just scratch your head and think about all the different pieces of anatomy that we can just gather just from this. And by the way, if you do see an artifact that you want to call out that's bad, like later, I don't know anything. But as I just, I see spinal cord, brainstem, cerebellum. I just think what a beautiful thing this is. And all organs, all parts of our body are just amazing. But isn't this just so cool? But it doesn't take much. It doesn't take much to change things. So here's your patient for today, 52-year-old female. This is actually her. Presents in your clinic, having returned from vacation, doing this. And then I'm going to let her explain her symptoms. Come on up, Sharla. Okay. Or you can sit. You can stand wherever you want. Okay. We're shy around microphones, if you've seen the podcast.
So I had to write down some dates real quick. So we were in the BVI's on a live-aboard catamaran for a week. And we dove every day, sometimes more than once a day. And was there March 31st we dove, April 1st, a couple times, April 2nd, a couple times, April 3rd, April 4th was our last dive. And I think it was the Monday after we got home. So 3 days later, I went to urgent care. And all the way home, I was starting to feel worse and worse. But once I got home, I knew something wasn't right. And 3 days later, went to urgent care, primarily with dizziness. So very dizzy. I had leg weakness. I was really struggling cognitively, and I didn't really understand why, but I couldn't focus. It felt like I was intoxicated. When I would have a conversation with someone, it felt like every bit of energy that I had was trying to understand what it was you were trying to say to me. And I was like pouring every bit of energy into like, what are you saying to me right now? And so difficulty focusing. I couldn't remember things that I knew I should remember. I couldn't remember words that were really simple. For example, I was trying to describe a sweat lodge that someone had told me about, and I knew sweat lodge, but all I could remember was it's hot. It's this hot thing that you go into. It's this house that's hot. And so I couldn't come up with words. And the dizziness was really significant. So I probably shouldn't have, but I drove myself to urgent care. And you want to go from there?
Yeah.
Is that it?
Right.
Okay.
So what questions do you have? I'm just going to pull up. This is just information from the clinic visit. I was able to pull the records. So O2 sats 96, heart rate 85, blood pressure's what I want mine to be at, right? What other questions do you have for your patient right now?
How deep did you dive? Did you do your decompression stops? Those kind of things?
Yes, perfect. And I'm going to get to that. Deepest dive was 60. All decompression stops were mandated. There were no rapid ascents. So we had no issues with a rapid ascent. We did our clearing, our 3-minute safety stop every single time. We had none of those issues. Yes?
Oh, you were on a liveaboard?
Yes.
How many times did you dive that week?
So I think we're on for 6.
I did 8.
She did 8 dives.
8 dives total?
8 days total for the vacation. And we are moving ahead, but I'm glad that you guys are digging into this. Our last dive was Thursday in the morning. We didn't get on a plane until late Friday night. So we had a good 36 hours between any bottom time. And our last dive, for those of you paying attention to diving, our last dive was under 30 feet. So it was like a 15, 20 foot dive. Actually, that might have been the last dive. That was our last dive.
For how long?
55 minutes.
55 minutes. Yeah. I mean, we have the dive computer, so we're busy trying to dig into all of this data.
30 feet for 20 hours.
Any encounters with marine life? Any stings? Any envenomations?
No.
Scraped on coral?
Scrape on the coral? I'm asking.
I not that I remember.
Yeah. So
I was pretty covered too.
Yeah.
Like that the whole time.
those are really warm. You would think that you would be warm in 86 degrees, but you're not. You get cold, it saps the temperature. What else? Any other questions? I woke up at 3:30 this morning saying, I wonder if blood gases show that, but it doesn't. An AB blood gas won't show anything. Steve?
Any history of like motion sickness, seasickness, any medications that were taken for that?
No medications taken, but a lot of history with seasickness. As a matter of fact, the boat was always rocking. She never felt great on the boat. So always felt a little bit off.
When you got back, when did the symptoms start the very first time?
That's the difficulty in pinpointing because the dizziness was ongoing throughout the week
the time.
being on a boat. So
You have that history of it.
when I got off the boat was when I knew, like, okay, I'm really dizzy. But when you get off a boat, you often have those sea legs, you're wobbly. And we hung out at the resort for the day waiting for our flight that night, and a couple of people were wobbly getting off the boat. I'm like, okay, I'm like everybody else. Everybody's a little wobbly. A couple of hours later, I asked a friend, I'm like, are you still feeling wobbly? Because I'm getting worse. And she's like, no, mine's passed. And I'm like, oh, well, I'm getting more dizzy. So that was when I knew for sure.
Knew something.
Were you sick before the vacation at all, or no sinus, nothing like that? Any other medical history that pertinent?
Does have PVCs, but actually a lot of people tend to have PVCs on and off. So at this visit, it was pretty consistent with her PVCs. I like to call her my little canary in the coal mine. When we go to altitude, at times she would start having a little bit of PVC issues. And I think it's just a pressure gradient kind of a thing. Other questions? Yes?
Yeah, I was gonna ask if there was compression in the ears or pain in like the nostril area, like going down when you were diving or anything like that.
It was typical. Like, I was able to clear my ears normally.
Cool. You guys got all the right questions. Assessment. These are his assessments. We have palpitations. For some reason, we got a diagnosis of anxiety, even though the notes didn't pick that up. Abnormal EKG and decompression sickness. He's like, sometimes Occam's razor, right? Like, if all else things, like, do we have decompression illness? So that was the question. So here's the rules. We talked about this, right? You're always going to allow your 3-minute clearance, especially we want to ascend no more than 33 feet per minute, which seems like a lot. So one of the rules is sometimes follow your bubbles up if you don't have a watch, because you can't, if you don't go any faster than that, they're not expanding. Avoid heavy exertion, especially at depth. Single no compression dives, multiple decompression dives, we want to wait 18 hours, 24 hours if you're doing multiple dives. So we followed all those rules. We were on a dive charter. They paid attention, made sure that we were working good. So they call it the bends, or DCI, decompression illness. I guess the bends is because you bend over in pain when you immediately come up and start to have that. This DCI is generally an issue that happens immediately after your dive. And usually it's, I came up too fast, or we call it an ascension issue. Either you're running out of air, or you just, you ballooned up, one of those two. Or I was watching some Discovery show with a deep sea diver that are working on pipelines, and even though they were in a full suit, they still had to come up and get into a container because they were still having lots of pain. typical symptoms really are like this joint pain. That's what we hear about. Everybody talks about this: joint fatigue, skin rashes, feeling sick to your stomach. That's type 1, which is normal, and it happens at the crater all the time. People ascend too fast. That's the best place to dive around here. They ascend too fast, or they're not paying attention, and they can get that. Rarely we get to 2. This is where you really had you were super deep and you decompressed rapidly. You came up from 60 feet without doing a safety stop or without ascending slowly. So this is type 2. So nobody asked if we got a brain scan. So we had a stroke scan done. And I asked Tyler to look at it for me, as well as another neurologist looked at it. No artifacts, nothing happening there. Again, I just love the visualization of the brain. So as we start to rule things out, did we have a stroke? Do we have an embolism? Do we have some sort of a TIA? Like, we don't really know, but neurologically, everything is fine, at least as this organ goes. Okay, so we'll see if this video is gonna play. Maybe.
Decompression sickness happens when someone ascends too quickly after being in a high pressure environment like deep sea diving or spacewalks. At high pressure, nitrogen dissolves into body tissues, but if the pressure drops too fast, nitrogen forms bubbles in the blood and tissues, which can block blood flow and reduce oxygen to the brain or nerves, leading to symptoms like confusion, numbness, or even paralysis. If not treated quickly, decompression sickness can cause long-term nerve or brain damage. Did you know this could happen from diving?
No, I didn't. Thanks for that. Unbeknownst to me, Sharla had, because she was feeling the PVCs, she'd actually scheduled a cardiology consult for the same week.
Yeah, there were 2 or 3 events while I was underwater that I describe as the whoosh, and it's just where I just felt like faint. Like, all of a sudden, out of nowhere, I was just like, whoa, I feel like I'm gonna pass out. And I wasn't sure if it was the PVCs, I wasn't sure what was going on, but when I got home on Monday, right before I went to the urgent care, I started wondering, could these symptoms be related to something, that I needed to go see a cardiology, get a cardiology consult for. And so in my mind, I just thought, maybe this has something to do with my heart. And so I had scheduled the cardiology appointment before I went to the urgent care.
So we go after urgent care, you just go to cardiology.
So I go to cardiology and I describe the whoosh, the 3 times that I had the whoosh, and I'm describing my symptoms. But let me back up, because at urgent care, he said, I think you probably have decompression sickness. And I said, no way. There's no way, because the common symptoms are joint pain and rash. Like, that's what you always see. And I followed all the rules. I didn't have any rapid ascents. There's no way that this is decompression sickness. And I kind of blew him off and went home and made the appointment with cardiology instead, because I thought that has to be it. And then just kind of as the day went on, I thought, well, maybe I should just go find an outpatient hyperbaric chamber just in case, get a little bit of oxygen, but I really don't think he's right. So I found a physical therapist actually in Provo who had not a hospital grade one, but I went and did a couple chamber sessions just in those collapsible hyperbaric chamber units. But my symptoms were actually continuing to progress between that urgent care and cardiology appointment. So by this time I was having double vision. I had blurred vision. I had difficulty with depth perception. I would look in the rearview mirror of the car and my eyes wouldn't adjust to the rearview mirror. So I was having a lot of visual disturbances and also sound. Like, it was really difficult to be in groups of people and to try to pay attention to different conversations. So I go into the cardiology appointment and I'm describing all of this to him. I told him about the whoosh. I told him about the sensations that I was feeling underwater. And I said, I just want to make sure I'm safe to dive again. That's really why I'm here. I just want to make sure it's not something wrong with my heart if I'm going to dive again. And he said, I think you have a PFO. And I'm like, you haven't even examined me yet. What do you mean I have a PFO?
So.
Is that where you want me to go to?
That's where I wanted to go. Thanks.
Okay.
I'm glad I brought you. It's awesome. We'll turn this one up. Did it not go?
Here, we show a transesophageal echocardiogram with agitated saline detecting a patent foramen ovale, or PFO, which is an opening caused by incomplete fusion of the atrial septum. Labels show the right atrium, the left atrium, and the atrial septum that separates the two chambers. Agitated saline from the right atrium, highlighted in green here, is shown to cross into the left atrium, which will appear within 3 cardiac cycles, making the diagnosis of a PFO. The large shunt here is defined as more than 20 bubbles appearing within the left atrium, which will appear within 3 cardiac cycles after venous injection of agitated saline. This particular patient has a high-risk PFO, given its large shunt size and a concomitant atrial septal aneurysm. A concomitant atrial septal aneurysm is defined as 10 millimeters or more with excursion of the septum.
So that's not
Here, we show
her.
a
Thank you.
transesophageal-
So you saw the green on one side versus the other. Imagine that's nitrogen bubbles in the system that haven't been cleared. Normally we can take enough nitrogen because it goes throughout our whole system. But if we take that concentrated amount of nitrogen and then nitrogen gas and we allow it to shunt right to left, where's the one place that's going to go first? All right? So that's called cerebral DCI. And question?
Were you, with your diets, were you on air or nitrogen?
Air. Yeah. So that's a really good question. So if we have a left to right shunt, what is it, 28% more likely? If you have a PFO to get...
I don't remember the numbers.
Yeah. So come to find out, Sharla has a PFO, which is 28% of the population has undiagnosed PFOs. I was watching a video on it the other day, and the doctor is very clinical because they're cardiologists. They said, "Oh yeah, that's just it's not a defect. It's an anatomical, not abnormality, but variant. Yeah, it's an anatomical variant. They look at it because so many people have it. Now, there are some issues with cryptogenic stroke. People that tend to have a cryptogenic stroke and they test them often can have a PFO, so there is a link there. But diving is problematic with a PFO. So how does a PFO increase the risk? We talked about that, but the bypass mechanism allows the nitrogen bubbles to just shunt left to right, and then they go straight to the brain. And then you end up with a more serious case. All of those symptoms, oddly enough, are very similar to the symptoms that Sharla was having, but unrecognized. So it took a while to kind of get down to, well, I never had a rapid ascent. I didn't break any rules. I didn't have any immediate symptoms. All of the things that you would think that decompression illness would have, didn't have. And then why did the symptoms start getting worse? Here's the other thing about nitrogen gas. It loves fat. This is why it tends to deposit in the joints and in the subcutaneous tissue. What's this thing full of? Full of fat, right? This thing is just lots of myelin sheaths that just have that. So it takes a while to get it out. Clearly the treatment, the first and most effective treatment, because sometimes writing it out is the other treatment, but that's not effective, is just hyperbaric oxygen chamber. And usually that is done immediately, and they won't put you on a plane. So if you're on a dive somewhere and you come up with a bends, they want to take you on a boat to the nearest chamber, because getting in a plane is going to decrease your pressure gradient and make things worse, which is likely part of the problem that Sharla had. Was we got on a plane unbeknownst to us and moved those symptoms a little bit better. So we were lucky that Utah actually has, oddly enough, some of the best hyperbaric chambers in the country, and probably one of the best hyperbaric medicine guys down in Murray. He's known worldwide. And it's generally called dive medicine, but there's a lot of things that they use hyperbaric oxygen chamber for. But what is it, like wound care. It's coming into its own for brain injury and stuff like that. The difficulty is it's a cost. When I called Utah Valley Hospital, when I called them, I said, what do you need? Because she has a diagnosis of DCI. The only one really came from the cardiologist, and so we had two. What do you need from me? And I talked to the nurse, and she says, this is weird. We usually don't get, patients usually come straight here, usually from the crater, where they had a rapid ascent issue and they had the bends, and we put them straight in to the chamber. So they took and did some assessment from Sharla. Everybody's familiar with the MOCA, or at least you were when you were in school. So this is just an assessment. The bottom end over here is kind of what we tend to do for in concussions. And I kept just basically, when I would watch Sharla interact with other people, I said she feels like she's like a post-concussion patient, like just with the difficulty finding words, difficulty with recall, all these types of things. So this is our first MOCA, difficulty drawing the square. The clock is good.
Yeah, I struggled the most with the square and so you're supposed to go from 1 to A, where does it start? 1 to A, 2 to B, 3 to C, 4 to D, 5 to E. And I could not that was one of the executive function piece that was so interesting. I had a really hard time seeing steps. And so I would look at that and go, okay, 1 to A, because it's telling you gotta go 1 to A. Okay, then what would be next? Would it be B? Would it be 2? What would be next? And I couldn't figure out the pattern. So you can see I did this triangle from C to D to A, or 4. I went around and around and around and got stuck there. But I just remember how slowly I was trying to process and figure that out. And as I sat there trying to do it, I was bawling because I knew how easy this would normally be for me. And I just couldn't figure out what that next step would be. And the same thing with the square. After I drew it, which took me forever, I worked so hard on that, like I was Picasso or something. And then I sat there looking at it going, I think something's wrong, but I can't figure out what it is. Yeah. And then the clock wasn't as hard for me, but the what was the other thing? It was really difficult. A lot of the delayed recall, that was tough.
Yeah, words. I'm going to tell you 5 things, and then you tell me what those are.
Yeah.
So, get the treatments, which was great. By the way, fun things. When you're in 100% oxygen, they make you change out of all your clothes and take all your metal off.
Even your underwear, you have to wear scrubs.
You had a Kleenex with her or something in her hand because her nose was running, and they stopped it, made her take the Kleenex back out. So, we don't want people to catch on fire inside of the chamber. So this is treatment 3. 30 out of 30, had no problems with that. Actually, after the treatment 1, she was doing much better. How many treatments did you have? 10. She did 10 total treatments. And it's like day after day after day after day.
The vision stuff was not as fast to come back. I still had blurred and double vision almost all to probably session 8 or 9.
Yeah.
But the memory and the executive function was probably the first thing I started noticing the big difference with after session 1 and 2.
Yeah. And kudos to Utah Valley Hospital. When I called and talked to the nurse, she said, just bring her in. I explained the symptoms and I said, what do you need? Because we're so used to the world when we live, like you need a referral from somebody. And I was like, who do you want me to send a referral from so that we can wait a week to get you in? And luckily, they're used to dealing with emergent people. Great staff over there. They even signed a little card on her graduation day for her, and it was awesome. So, next question, and this is the end of the presentation because we can ask questions if you want. Do we close the PFO or do we leave it open?
Close.
Want to die?
Yeah, if you want to go.
Yes, right? You don't want to die, you close the PFO. And
Dive, not die.
yeah, I say die. I see the stroke thing, but if you want to dive, do you still want to dive?
Oh, I won't dive right now. No, because it's just a matter of when it happens again. And honestly, I was lucky. The next one could be life-changing. I'm in a number of different groups now with people who have had decompression sickness and learned more about how many of those have PFOs and how that the neurological effects for many people are forever. They don't ever improve. So I feel really lucky that I feel that I think I'm back to normal. I think I am. And I wouldn't risk it again. So I do want to dive. I love diving, but I won't dive with the PFO open.
And the only problem really is that Revere's cardiology department sort of blew up. So the people that who were slated to work on the closure are no longer in town. So we have to start over with somebody new. Questions? No?
How's it been flying? Like you've had some flights and things like that with those pressure gradients. Has that changed?
Yeah, no, it's just as it was before. It's normal now as it was before. Like I still get PVCs when I'm flying, but that's the same as it was.
So the underlying issues with PFO explain a lot of things with her. She has never really enjoyed strenuous cardiovascular exercise. More yoga and Pilates for her. Not that any of us really enjoy strenuous cardiovascular exercise. Maybe I misspoke. But for her, when her heart rate gets really high for a prolonged period of time, she feels worse. She feels like crap. She feels tired. Why? She's shunting, right? So it sort of explains a lot of the history that we've sort of known with her. And I'd be interested if and when she decides to do the closure, whether or not altitude becomes less of a problem. But I think as we talk about increasing external pressure or decreasing external pressure, I think then we can tend to shunt.
I think it was interesting because the doctors at the hyperbaric here in Orem were amazing. I didn't realize how few of chambers there actually are in the United States and how fortunate we are to have this in our backyard. I just feel really blessed about that. But they were curious because my symptoms were delayed. My treatment was delayed. It was probably over a week before I actually got treatment. And they were like, I don't know if this is actually going to help you. You know, you've got delayed treatment. We don't really normally see cases like that, and there's no studies on that to know whether you're going to get any results from doing hyperbaric work. So let's just see what happens. If you will continue to do sessions as long as you're seeing changes. And so everyone was really curious, kept coming in to see, like, does it actually work to get treatment a week and a half later? And then I got sick in the middle of treatment with the sinus stuff, and I had to stop for a couple of days, and so then it was even more delayed to finish, but it worked.
Yeah, doing good. All right, guys, thank you very much.